Oh, Dan. Hi, Dan.
Hello.
How are you?
I'm all right. I'm good, thank you.
Good. So, you want to come in today to talk to us about mental health?
Yeah, that's right.
Yeah. Is it kind of mental health in general, or is it something specific that has kind of zoned it that you want to zone in on?
So basically, I've come down to speak about improving mental health services. So I'm a mental health sufferer myself. So I was actually sectioned back in January, and I suffer with psychosis and with anxiety and with stress and post-traumatic stress. So mental health is, it's an issue that's particularly close to my heart.
Yeah.
And I think that, I shouldn't have been sectioned in January, but I was. It was, it was the treatment that I received from frontline services that frightened me, and it allowed it to escalate in my head, and so I became very unwell, and so I was sectioned. And I think that, it was a dire situation to be in. It wasn't. It was a terrible situation to be in. But I used my passion for journalism to really to talk to the other patients that were there to find out, what was going wrong with the system, because I could see there was a lot of things that could be improved. And really, I spent my time doing that. I spent the time looking at the systems, talking with a lot of people, doing a lot of research, and really coming up with lots of ideas about how we could improve this, because I use a thing called lean methodology, lean thinking, which is identifying root cause of a problem and then coming up with ideas.
Which sounds kind of, it sounds kind of common sense, doesn't it? It sounds kind of like that's how we should be working. Surely we should be working as to figuring out what the root is and then going from there. It kind of baffles me as to how that's not working already. Is that not the case at the moment? Is it?
Well, I would say that there's certainly things that do work, and and I'm not trying to pull the NHS apart. They do a very good job, and and there's a lot of very hard-working staff. But there's a lot of improvements that could be made, and really simple things that don't have to cost the taxpayer an awful lot of money. These are things that and more first aiders, so more mental health first aiders in our frontline services is such a simple thing.
Definitely.
Where they could treat people at the scene rather than allowing it to escalate because they don't understand what's going on with that particular person who might be suffering with psychosis, and then having to go to hospital, taking up a bed, and all the costs that that incurs. If they had that mental health first aid training, they could treat that person at the scene and stop it from escalating
initially. And that's the thing, isn't it? People always think, oh, just give more money to mental health services, give more money to the NHS, that'll solve everything. And I kind of don't think it will. I don't think it will, that money solves anything, really. I think it can help. It will certainly help because it'll get you more people into training and things like that. But definitely, I agree in terms of getting mental health first aiders is probably a massive thing, isn't it? Because that's someone straight away that's going to be there with you, understanding your condition instantly, and trying to be able to create a conversation to help you kind of discover what's wrong with you and how you can help yourself, I suppose.
Yeah, exactly. So, as a sufferer of psychosis, if I have somebody who's able to just be very calm and deconstruct it for me, and I'm able to do it myself now, I know my triggers, I know the things that can cause it, and that's been trial and error, but, if somebody can very calmly talk to me and just deconstruct what's happening around me to stop it from escalating, it can actually be stopped quite quickly and quite instantly. So I went away, and obviously I've been off work, and I decided that I would use social media, my Facebook page, as a platform really to tell the story of mental health. And I've been living my life out on Facebook, and I've been doing it in a variety of ways. World first in storytelling. I've put together a gay love story, which is all around mental health. It's a true story. It's about myself and a guy called Matty, and he had an undiagnosed mental health problem, and which I quickly picked up on, quite straight away. And then, events took a dramatic turn when Matty was found walking up train tracks towards an oncoming train just the other week. And and so obviously I had his full agreement to tell our story, and so I did. And on my Facebook page you've got post for post, me trying to get to him and find him and help him, but then also the story goes on to kind of explain how we got his diagnosis for bipolar, and how he's doing now. He's on his medication.
I suppose it's one of those, isn't it? I think mental health is such a wide array of mental health issues, isn't there? I don't think there's not one person that deals with mental health the same. Everybody has a different kind of mental health issue that needs treated in a certain way, and it needs to be tailored to each individual person. I suppose that's where it's interesting, because using Facebook and using online to tell your story, it's one of a couple of stories that's on there, isn't it? And it's given a different angle to mental health that people might not be aware of?
Yeah, I mean, what I've tried to do is I've done a thing called conscious writing. So because I've run out of money, I've been, I should also say that I'm a recovering drug addict as well. And, and so I couldn't afford to have go to private rehab. That was around £16,000 a month.
It's a lot of money, isn't it?
It is. And, the NHS was going to be a 7-month waiting list, and I was given a month to live, if I continued doing Class A drugs. And, as an addict, obviously I realise that's a bad thing, but an addiction is an illness, and it's an incredibly difficult thing to get over, and especially if you're a sufferer of post-traumatic stress. So I came up with the idea of my own homemade rehab, and that was actually enlisting my own team. So I looked across the country and looked at all the different rehabs and what they offer. And I looked at the Priory, because that was one, where the celebrities go. And I thought, well, if it's good enough for the celebrities, it's good enough for me.
Of course,
And, so I looked to see, what level of care they got, what level of psychiatric care, what level of, nutritionalist, all the rest of it, and how many times a week they got it. And then I mirrored my own rehab and handpicked my own team of people that would be equivalent, if not better, than what you would get at the Priory. And I've been able to keep that team of people on, for some time, but unfortunately I've had to let them all go as I'm living off statutory sick pay. So, that's been a bit difficult.
I think, isn't it a sad time in society where we have to do that, though, where we have to create our own teams of people to help us through our own kind of mental health issues, where I think it's just a sad time that you've had to do that in general, I think, at first, but it's also an amazing thing, because you think, really, you've combated your own mental health issues straight away by thinking, there's no service that's going to help me, I'm going to have to help myself, I'm going to have to find a way myself to get this care through.
I had to be creative with it,
that's
and
it.
I had no choice, because it was either do that or die, and I've not it has been, I've had to sell all my possessions, I've had to lend £1,000 from my mum, I've been living off half wages, and it's been a struggle. It's been a real struggle to keep the team going, and to but luckily I've stayed sober since March the 11th, and so that's been great, and I'm feeling good in myself and ready for work.
Positive way to say that you were sectioned, January, did you say?
Yeah, that's right.
So what a turnaround from January to March. That's a massive turnaround, quite a quick turnaround.
Yeah, it's been a lot of hard work, and I've put my heart and soul into it. And
I think you can tell that you have, because it's such a short. Normally, if you go into rehab somewhere, you're in for a couple of months, 6-7 months at a time, sometimes, can't you?
Yeah.
So I think that just shows your dedication within it, of how much you want to improve yourself and how much you want to improve yourself. That's the wrong word, I apologise.
That's all right.
How you kind of want to make yourself better and move yourself forward.
Yeah, no, I mean,
it's quite a good.
Well, that's what, and Facebook has been like my therapy as well, because it's rooted in mindfulness, what I'm doing, conscious writing, and and I think that because I can't afford a therapist now, I've had to let them go. That's why my Facebook has become my outlet. Yeah. But it's so important for me to improve mental health services in the UK, and I've been really trying to get all my Facebook friends to support me, to share the posts, to create a viral hit, because in order to, if we create this viral hit, then I'll be able to go on, to do my work to improve services. Yeah. So all of the details are on my Facebook page, how I'm going to do that and why I'm going to do that. But so have a look.
I think people slag Facebook off and social media a lot of the time, don't they, and say that it's not really a place to go and bear your emotions, is it? Yeah. But I think it's probably the opposite, isn't it? It's a great platform that you get to a lot of people very quickly, and it's just people quickly have a quick read. Even if it's one sentence, if someone reads one sentence of something that you've put on and you've helped someone, then surely it's
Yeah, I mean, I think that the one thing is that we've forgotten, I think, how to use social media. You know, it's supposed to be sociable, and you know, and I put together a call list, you know, of all of the people that weren't engaging with me, that weren't interacting with me, and you know, pretty much weren't supporting me in my cause. And you know, and somebody said to me, you know, well, don't take it personally, you know, and I thought, well, actually, you know, I've been doing this now for about 5 months, and you know, and I've been updating them with my story. I've been very brave. I've been very honest, incredibly brave, actually, courageous with some of the things that I've done. And I think, no, I think I deserve a like, or I deserve some kind of interaction or engagement, because you know, I'm supposed to be their friend, and you know, and if they don't feel that they can do that for me, then why would I want to have them surrounding me? You know, I need to be surrounded by supporters and positive people and people who are going to help me to improve mental health services.
I think a lot of people, especially with Facebook and Instagram now, it's all about getting more followers. But if those followers are not authentic enough to like and to talk to you and interact,
yeah,
then there's no point having.
That's exactly my point.
Not
So
having that many.
I went through a cull last night. I culled about I was about 60 of them. There's a few more still to
It's
go
always
through.
good to have a good resource, I think, every so often.
Yeah, I mean, it's, you know, it's not personal, but, you know, at the end of the day, I need to have supporters. I need to have positive energy. I don't need the silent Facebookers that are just going to sit there swinging on their chairs and just not engaging, not interacting, not caring, and you just think...
Facebook is full of those.
I know there are. So anyway, I've got rid of them.
Yeah, which is good. It's a good place to start, I think, for anyone going through any form of mental health issue. I think. 'Cause do you think social media can sometimes go towards people's mental health issues? Especially, specifically, look at Instagram, for example. A lot of self-esteem issues must come from that.
Yeah.
A lot of people feel like they're not getting enough likes, so they're not getting as much. Are they liked in society? Are they not? A lot of issues can come from social media.
Definitely.
How are you using it to kind of get people away from mental health and try and show that this is actually how you can help, rather than don't allow social media to... I'm trying to think of the word.
I know what you're saying. So I think what you're...
Don't let social media harm your mental health, but actually help it. And
so that's exactly why I had a public cull list, because I kept thinking, you know, this is very strange. You know, you know, I've been trying for months. These people, you know, clearly know that I'm trying to improve mental health services, which is a benefit to all of us. 1 in 4 of us are sufferers. You know, why do they feel, and they were posting things, you know, why do they feel so, you know, strongly that they can't even give me a like or a comment or engage with me? And so, you know, and I think that people who are being bullied, for example, you know, they may feel the same, you know, low self-esteem, all the rest of it. So my answer to that is get rid of them. Just get rid of them, because you don't need it. You need, you know, like I say, you need to be surrounded by positivity, people who support you. I don't need that. I don't want negative people in my life, so I've got rid of them.
Excellent. That's all. I've always been a positive person myself. I love anything negative is gone out the window.
Yeah, absolutely.
I'll accept it, and I'll have a debate with it sometimes, and I'll try and turn that negative into a positive. But I get really irritated and really annoyed when you scroll down Facebook and all you can see people slagging off the world, hating life, and you just think, why are you there? What are you doing? What are you doing and contributing to the world and society today?
And I think it's
not a lot.
Well, it's shown me a lot of, you know, it's shown me true friendship actually. And you know, there's you know, a good friend like Lynn, for example, who you know, has been at home and she's been sending me ideas through saying, oh, have you tried these? Have you tried them? Have you tried them? You know, have you tried to, in order to create this viral hit? And you know, she's been amazing. And you know, she's been up late. I've got my thinking hat on, and I think that is a true friend. That is what I want from Facebook.
Definitely.
A friend,
someone that's able to help and assist you on your journey.
Absolutely. Yeah.
So how then, via Facebook, are you using Facebook to try and improve mental health services then?
So I'm using it in a variety of ways, and the main way is by doing world firsts in storytelling. So I've mentioned about Dan and Matty, which is the love story. You know, I've tried to make a gay love story that is accessible for the mainstream audience. It does talk about homosexual sex, you know, within it, and that was deliberate. You know, I wanted to, you know, I'm very lucky that my Facebook page is a mixture of gender, sexuality, ages, and I thought it was very important that we talk about gay relationships in exactly the same way as we talk about heterosexual relationships.
100%.
You know, the excitement and love and passions are still exactly the same, especially when you first meet someone. So that was important to me. But I did it in a way that I told the story by the WhatsApp audio messages that I left Matty. So every time that we met, I would record him a message, and I put those messages together, and I've created a story from the messages.
Nice way to kind of
so it's literally answer phone messages. I've done Psychosis Live, which is when I withheld my medication, and then I talked about when I knew that I was slipping into psychosis, I hit record on my phone, and then I talked about the day that I was sectioned. And, you know, so you can hear somebody suffering with psychosis, you know, live, and I thought that was, again, another important...
That's really interesting, that, isn't it? Because I think a lot of people will read about it, and a lot of people will hear about it, but to physically, literally hear it and be there with you at the time, it's quite...
Absolutely. I mean, you know, it's quite disturbing, but it's groundbreaking. You know, I mean, I've not seen somebody do that before, and equally, you know, using Facebook as your therapy, which is what I'm doing. You know, there's not many people that do that.
I'm sure Facebook would love to speak to you, because that's a great advert for their site, isn't it?
Well, I mean, you know, Facebook saved my life for Christmas and New Year, and it did, because I was left in my flat on my own having a mental health breakdown for 5 days. And if it hadn't been for Facebook friends, and if it hadn't been for Facebook, when I reached out to them and then they came through with messages of support, that kept me going, you know, and actually, you know, I could have lost my life. And so I'm very grateful to my Facebook friends and to Facebook, you know, for what they did for me during that period.
It's a great platform to be there, isn't it? And it sounds like you're utilising it to the best of its ability.
Yeah,
really,
I'm using, I'm finding out new things, I'm discovering new things about it, but, I'm using it to tell stories. My page is become, well, like a rich tapestry of storytelling, and, at first look, it might not look, it might look a little bit of a car crash, but believe me, it's not. It's a piece of art. I've spent a lot of time, with my writing, with the audio, with the videos, whichever medium that I've used, I've tried to think carefully and, thoughtfully how I'll tell a story of mental health in the UK.
I would say, I said earlier on about how mental health is different for everybody, but I think the one thing that I always see in mental health is creativity. I think no matter what kind of mental health issue you're suffering with, creativity tends to help that in some form, whether it be using Facebook as your kind of drawing pad as such, or kind of using a literal piece of paper and a pen. Would you say that's kind of right? Would you say most people use things?
Yeah, I mean, creativity, there's certainly, it's helped me. I'm in a very worrying situation at the moment financially. I've got £2.34 to live off for the month, so it's not great. Yeah. And, I'm having to look at food banks and, people, my mum has loaned me 50 quid, and that's because of statutory sick pay. I'm left, and that's another issue, that we should be talking about. And I'm trying to, obviously, not have a mental health crisis because of it. And I think a lot of people would, being left with £2.34.
Of course they would.
But actually, by using Facebook and being creative, it's kept my brain busy and active, and and I think that certainly back in January, when you lose everything, then you realise that you've got nothing more to lose and a lot more to give. And and that really is my motto.
I think that's it, isn't it? Is that once you've hit a certain point, it kind of hits, doesn't it, with you, and you know that I've got to do something, or I'm not going the other way. I've got to get better. I've got to. Yeah,
absolutely. And I think that I just was so, I went away, and obviously I spent a lot of time in a room, in this pokey, small, smelly room, when I was being sectioned. But I used that time, to develop ideas in my head, to develop these ideas that I'm putting out onto Facebook, the storytelling, the platform, the way that I was going to do this, and how I was going to improve mental health services in the UK.
Yeah, which is brilliant. So if people want to kind of know about I'll start that again. If you want to know a bit more about your story and they want to kind of have a look at your Facebook and get involved, how can I do that?
So they can go onto my Facebook page. So it's Dan Foster. At the moment, it's got Dan Live. Will he have a mental health crisis? Right across the banner at the cross, and that's for Mental Health Awareness Week. Actually, I've put that together. But my Facebook profile is danfoster.org.uk, and if you like, I'll send you a link through as well. So I don't know if you can maybe share something on the website, and then people can have a look. But it's all completely free. It's not it's not money, but it is meant to be having a real, true conversation, an honest and frank conversation about mental health services in the UK.
It's brilliant. I think a lot more people should be like you. A lot more people should be having that frank conversation.
Thank you.
So well done. Honestly,
it's
brilliant. It's a great thing to do, especially during Mental Health Awareness Week.
Yep, thank
brilliant.
you.
Thank you for coming in.
That's okay.
You're welcome to come in any time.
Thank you.
And we'll keep up to date with your progress online.
Thank you.
Yeah, thanks, Dan.